May is Mental Health Awareness Month, and about 20% of U.S. adults experience some sort of mental illness each year. But there is a shortage of mental health professionals, and more than half the people who need help have trouble getting it.
Dr. Noelle LaForge from the DU Graduate School of Professional Psychology joins us now to talk all about mental health. So you work on a college campus. I can only imagine that you are there and you can it's a microcosm, of course, of what a lot of Americans are feeling. But what have you seen specifically college students face right now?
Sure. Well, actually, the clinics that I work for, we serve the general public. We serve all of the Denver community. And so, here in Colorado, unfortunately, we have a really high prevalence rate for mental illness and substance use disorders. So we see people struggling, whether it be anxiety, depression, suicidality, other mental health disorders. Stress is really high right now, and so folks come to us, and we're training the next generation of mental and behavioral health care professionals to meet that need.
When I think about mental health, the first thing I think about, the first step, is acknowledging that you need the help. And there are such stigmas attached, especially in marginalized African American, communities specifically. But do you see those stigmas prevent people from actually seeking the help they need?
Sure, absolutely. I mean, I hope folks can start to see we're really working on this on the education and training realm. As you mentioned, people want to see themselves represented in the people that they get help from. It's really something that we are working on. I would encourage folks, mental health treatment is going to be more effective when you come in early. And so trying to overcome that initial, do I need this? Do I not need this? We're here to help navigate that.
And if someone out there needs help right now, how easy is it for them to get help?
Sure. I mean, we're one of the solutions. So we're one of the largest Medicaid serving outpatient behavioral health programs. We also do sliding scale, so we are willing to work at a rate that just about anybody can afford. Beyond that, right, people can use their insurance, people can find places. Colorado is fairly good on the provider realm, but again, you see, it depends on the access to resources you have. So if folks want to come to us, we have availability. We just need to get you started with the phone screen.
Yep. It's good to know that there are organizations like you out there, because there are barriers that exist. You even mentioned Medicaid, and we know that's something that's up in the air. Are you guys potentially concerned about the effects in what you do?
Absolutely, right? We see a lot of Coloradans who need their Medicaid, and it's just disheartening to see, because it saves so much to invest at the beginning stages rather than waiting for things to get worse, which is what happens when people don't have access to health care.
And have you seen a change in just talking the narrative about mental health in the last 2 decades, 25 years?
Well, we're talking about stigma. I think one of the things that I'm happiest to see is a lot less of it. Folks are generally much more willing to reach out. Folks are being much more open about others that they know, how mental health affects their families, their loved ones, their friends. Workplaces, I think, are getting better, but there's still so far to go.
And you guys put on actual community clinics. Like, how does that work? Can you explain to our viewers?
Absolutely. We have several clinics through the Graduate School of Professional Psychology. We have the Professional Psychology Center clinic. So that's primarily serving adults through individual therapy, also adolescents and kids. We have our Cub clinic, which serves younger kiddos and their families. We have STERM, which serves military and veteran populations. Wow. We have our trauma disaster recovery clinic. So we have a lot of different clinics. All of them are open and available to the public. And a lot of times people are a little reticent, like, oh, I'm going to a training clinic, I'm going to be seen by a student. But what I hope people understand is really, I mean, you're getting the highest quality healthcare. You've got a whole team of some of the most renowned professionals training those students, watching what they're doing. You've never seen someone more evaluated and on top of their game. And so that's really what we do there.
You're doing some great work. Dr. Noelle LaForge from the DU Graduate School of Professional Psychology. We appreciate you. Thank you.
Thank you.